mental is vital. They're not just some rhyming words. It's something that's just got to be heard. Who is responsible for your health? Look in the mirror, it's your very own self. You can't rely on nobody else.
Your health is your wealth. Hey, hey. It keeps you alive. Your health is your wealth. No one can deny. It keeps you alive. Your health is your wealth. Hey, hey. It keeps you alive. Our health is our wealth. It keeps us up. As one. Oh, 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 oh. Oh, 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 oh. Oh, 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 oh. Oh, 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 oh.
Yes, your health is your wealth and it keeps you alive. Yeah, the time is 1 minute gone past the hour of 2 right here at Omoluwabi Radio 87.7 FM. And the program you are listening to right here is Health Plus on Omoluwabi Radio 87.7 FM. The program that we talk about how to take care of ourselves so we can look healthy, as not to be going to the hospital back and forth and spending the money we are supposed to be using to take care of ourselves, take care of other things in the house, spending it in the hospital. So this program is here to sensitize the general public on how to actually take care of ourselves. And we have different topics that that comes on here. We talk about different health topics, and it is not just about taking care of ourselves alone. We also talk about how we can actually stay healthy with eating the proper diet. That is why Health Plus is right here at Omoluwabi Radio 87.7 FM. And my name is Ebonluwa. I'm going to be a wonderful host for today. And yeah, we've been talking about some seasonal ailments, yes, because we're in the rainy season, we're in the wet season, and we know that the wet season actually has a lot of ailments that comes alongside with it. So we've been talking about numerous health wet season ailments. And today we are going to be discussing something that is also not really actually the seasonal, but something that is similar to seasonal ailments. Okay, and today's topic we are going to be talking about affective disorder. Yes, affective disorder. Some people will be like, what is affective disorder again? Which ailment is called affective disorder again? Okay, so before we dive into the program proper, I'm going to be giving you some highlights on what affective disorder is all about. Affective disorder is a set of psychiatric disorder, also known as mood disorder. Yeah, you can say it is also called mood disorder. It is an umbrella term that refers to different psychiatric condition that causes change to a person. That is when you notice that someone is overexcited in the morning and all of a sudden the person is just down. The person is not even lively again as before, and you keep on wondering like, what happened to this person now? But this person was hyperactive and every other thing the other time when I saw this person. What has gone wrong? Okay, so don't go anywhere, just sit back, relax, get your notepad, get your pen, and because you are going to really learn a lot of things from this particular section. Okay, affective disorder can also disrupt someone's life. However, there are effective treatments available, both medical and psychotherapy. About 15% of children and adolescents are affected by mood disorder. People actually experience this mood disorder. It is not all the time that you see someone happy. So like I said earlier, some people can be actually hyperactive in the morning and the next minute you are seeing them, they are down. So this mood disorder does not actually have to do with I am an elderly person, it doesn't affect me, I am okay, I am this. No, it actually goes around everybody. Anybody can have a mood swing. Anybody can have a mood disorder. And reports has it that about 10% of population over 18 years suffers from this mood disorder, especially the ladies. And why are the ladies having it a lot? Number one, the ladies are the one going through menstrual cramp. They are the one going through after birth issues and the other. So ladies have a whole lot of things lined up for them that they are going through. And this actually affects the female gender more than the men. the main type of affective disorder are depression and bipolar disorder, and the symptoms vary from individuals. A particular person will handle his own disorder, his or her own disorder, is different from the way someone else will handle his or her own disorder. There was a particular time I was having a conversation and someone was telling me like, if I am going through a lot, all what I just do is I just get a whole bowl of ice cream and I just start eating and eating and eating. I'll be like, and I was like, I don't understand. You are stressed, or you are going through some issues, and you are doing this, and I'll be like, okay, anyways, that is how you are going through your own mood swing. So it differs from individuals, and a psychiatric or a trained medical professional are actually the ones that can diagnose that yes, this person is having affective disorder. Okay, this is what we can say, that this is when we can say that yes, this person is having affective disorder. Okay, these are the symptoms of affective disorder. And in the studio with me this afternoon, I have my guest that will be doing justice to the topic affective disorder. How is this affecting us? How can we actually identify that yes, this person is having affective disorder? How can we say that okay, I'm seeing the symptoms of affective disorder in my behavior? Okay, it's like I'm having affective disorder. How can you even actually diagnose yourself and like, okay, I think I need to walk into the clinic, I need to go to the hospital and get some check done on myself because I think I am having this? And when you get to meet a specialist, they'll tell you like, okay, this is what you have been going through. Okay, I think this is what you've said you've diagnosed of yourself is actually what is wrong with you. And that is why you have Health Plus right here at Omoluwabi Radio 87.7 FM to sensitize you on things that we do not know about our health. Okay, so I'm going to be introducing my guest now. I'm having a wonderful person in the studio with me this afternoon. He is the Senior Registrar Psychiatric Department of UCH. Good afternoon, sir.
Good afternoon.
Good afternoon, sir. Dr. Tunde Theophilus. Good afternoon, sir.
Thank you for having me.
All right, I'm very grateful for having you on air today. Okay, so the first question I'm going to be asking you is, what actually is affective disorder? What do we know by the word affective disorder?
Okay, as you have introduced the terminology, affective disorder, otherwise called mood disorders. What happens in affective disorder is that the prominent problem the patient has is that there are changes in the mood. Ideally, our mind is supposed to be able to regulate mood based on what is going on in our environment. If you hear a bad news, you're supposed to feel depressed or feel sad and then move on later on. If you hear good news, you're supposed to be excited and then you move on later on. But in affective disorder, there is a swing to a particular pole, either happiness or sadness. And this persists for a long time, persistently. So for instance, if somebody has is swing to the depressed mood, like the person is feeling sad all the time, every day, every hour, continuously for up to 2 weeks, we say the person is depressed. Somebody could have elated mood, too excited, too active, talking all the time, too excited for no reason, going on for weeks, for days. Then this person has bipolar, or you can say mania, depending on the terminology you want to use. So in affective disorder, the prominent problem is there's change in the mood, which is sustained more than normal. And there are also associated symptoms with it. Things like, for instance, in depression, there could be symptoms of feeling loss of interest in things you like to do before. Yes. Low energy, feeling guilty, feeling hopeless, to the extent that some people have suicidal thoughts. Some people think of killing themselves. And we have patients that have attempted to actually kill themselves before they get to the hospital to be seen by psychiatrists. Then some people have problems with their sleep. They won't be able to sleep very well. They have a problem with appetite. So the same thing applies to the other mood, to the other pole, the mania pole or the bipolar pole. Okay. When somebody feels too excited for no apparent reason, they are too active, they are talking too much than before, they are taking they are involved in risky behavior. Like, they dash people their things, they give people their things, they do things they will not do normally if their mood is okay. Then they also have problem with sleep. They don't have time to sleep. They are too busy to sleep. So those are features that come with affective disorder. And then the two major ones that we see is the mania and the depression. Okay. So that's that.
Okay. So now I want to ask, is there any similarity between depression and affective disorder. And you also made mention of something. You said when one is not sleeping properly, maybe they are too busy to sleep. There are some people that their work schedule doesn't really give them that luxury of time to sleep. Like, okay, for example, I work in a particular place that I'm supposed to work at least 18, let's say 20 hours or 20 or 22 hours in the day, and they have limited time to sleep. And even though while they are sleeping, their mind is still like, I must still get up and I still have some things to do. So can you also say that it is also it is the cause of affective disorder, or they have trained themselves to having affective disorder?
And the thing is, depression is one of the manifestation of affective disorder. Affective disorder is the umbrella term for multiple diagnoses. For instance, in affective disorder, it also includes depression, mania, hypomania, bipolar. There are different manifestations: dysthymia, cyclothymia, recurrent depressive disorder. So there are many diagnoses under affective disorder. It's an umbrella term for all of them. But of course, common manifestation is to the two poles, too happy or too sad. So if somebody is trained is by virtue of work not sleeping, that one is it's not a disease itself. That means that person has work to do, and you have not been able to do your don't have enough time to do it. But you, even in that situation, most likely you notice that by the time the person is tired and exhausted, they'll be dozing off. It's like they want to sleep, but the time is not there to sleep. So it doesn't mean their mind is sick. So they are not sick. They don't have mental illness at that point. So it's work that is taking their time. Yes.
All right. Okay. Thank you very much. So you mentioned earlier, you said there are different types of affective disorder. You made mention of depression and mania.
Yes, mania.
Okay, mania. Okay. So can you tell us, are there similarities or are there difference between the two?
Okay, so there are two different manifestations.
Okay.
So mania is different from depression.
Okay.
In depression, the prominent problem is the person is feeling sad all the time.
Okay.
Persistently for days, for weeks, up to 2 weeks minimum. And then associated with things like they don't have energy to work, they have lost interest in things they like to do
before.
They are feeling guilty, they are feeling hopeless, they can't sleep, they are thinking of killing themselves, suicidal thoughts. And then some go ahead to plan the suicide and act on it. So that is the depression pole. That's like the low side of the manifestation. Then the other pole is being too happy. That's mania or bipolar. That person is excited or irritable. They get angry easily. They are too happy for no reason. Then they talk too much. They are too active. They are always going up and down. They have many things to do that they don't have time to sleep. So we say there is reduced need for sleep. Then they involve in risky behavior. They take decisions without thinking about it.
Irrational decisions.
Exactly. Something they will not do
on a
normal day. Then also there are two different extremes. There are two different manifestations. So they are not similar. They are two different. Even the management differs.
Okay. So when a person wants to diagnose herself of affective disorder, so once the person sees these manifestations, being over happy, doing things you're not supposed to, that you are not used to doing, like just know
talking
that talking too much. But some people just love talking a lot.
When you see somebody that has mania or bipolar, it will be obvious. The talking will be too much. It will be then
too extreme.
Apart from the talking too much too, there will be other things that will be associated. Like the excitement. The hyperactivity. Then the sleep will also be altered too. That person will not even have time to sleep at night. They don't sleep. Then they are involved in risky behavior. They are over generous. They dash people their things. They waste their resources. And then so other things comes with it. So it's not the only thing that will be there. So when people observe, then what happens when illness develop is that there will be a known behavior that this person is known to behave. But when there is a change in the normal pattern of behavior, for instance, people around you know the way you behave. They can predict. They say, "Oh,
this is how this person
is a gentle person before." But when that deviation comes, then it's pointing to a manifestation of an illness that needs to be reviewed and managed.
Okay. So, what is the latest diagnosed criteria and tools for affective disorder? Are there any latest diagnostic criteria?
Yes. So in psychiatry, we use diagnostic manual. We use what we call ICD-10 and DSM-5 to make diagnosis in the hospital. When a patient comes, we look at what the behavior of the patient is, and then we see if the behavior meets a particular criteria. For instance, there are criteria for depression, like symptoms of feeling sad persistently for minimum of 2 weeks, low energy, loss of interest in previously pleasurable activity, feeling guilty, hopelessness, suicidal thoughts, poor appetite, poor sleep. So those are the things we look. So we look at the behavior and we look at it. If it fits a criteria, then we say it is depression. If it fits, we look at the one for mania. If it's mania, we say it is mania. If it's hypomania, we say it's hypomania. If it is cyclothymia, we say it's cyclothymia, dysthymia, and so on and so forth, depending on the behavior the person is manifesting. So in short time, in summary, what we do is we take story of the patient, what we call history.
Okay.
So we want to know the behavior. What are the changes that have been observed in this person in the last 2 weeks? And then we now see if it fits a particular criteria. Then we make our diagnosis.
Okay, all right. You're listening to Health Plus right here at Omoluwabi Radio 87.7 FM. And the name of your wonderful host is Omoluwa Adubu. And the topic of discussion for today is affective disorder. Okay, so the next question I'm going to be asking, you said when you are making your gathering, when you are taking notes of how the person has been for the past few days or before the manifestation of the symptoms, I want to ask now that is active disorder, does it has to do with genetic? Because we sometimes most ailment that comes up with people be like, okay, do you have any history of it in the family before? And they're like, okay, it has happened to this person, it happens to that person, okay, it skipped a generation and moved and it reoccurred again. Does it has to do with genetics?
Yes.
Okay.
Yeah, if somebody has a family history of an affective disorder, there is a risk in their children and in the family that somebody else will have affective disorder. So disorders like depression, bipolar, if the parent has it, there's a risk in the children, they could have it. So genetics is an important factor. But of course, it's not just genetics that is important. There are other factors, environmental factors also matters. So there are predisposing factors, there are precipitating factors, there are perpetuating factors that we look for when we are seeing a patient, that will make up our mind. What are the things that we can identify in this person that is making this person have this illness at this point in time? So genetics is important, environment is important. The exposure to everything is important to know why this person is having the mental illness at this point in time.
Okay. So is there a particular age where you can say, okay, this is the particular age where it can actually, where these ailments can actually surface?
Okay, as you have said initially, it affects all age group. It could happen in adolescent. I've seen adolescent that has affective disorder. It could happen in middle-aged people, young adults. I've seen an elderly man that also has affective disorder. So it's cut across all age group. But of course, it's common among some age more than others. Okay, so it's common more in young adults than the two other extremes. So it can happen in all age group. Affective disorder, then of course more depressive, there are more more men have more the depressive episodes.
Okay.
So depression is more common in female.
Okay.
While bipolar is more in men.
Okay.
So there are some minor variations, but generally speaking, it could happen in both male and female, and it could happen in the whole age group. An adolescent could have manic episode, an young adult could have it, then the elderly too could have it.
Okay, all right. So I'm going to be asking this question. Once you discover that yes, you're having affective disorder, are there any coping strategies that, okay, for the meantime, maybe the person because you know the way the economy is right now and everything, and maybe like, okay, pending the time, the person is like, okay, before I bring myself to the hospital, is there any coping mechanism, like, okay, let me just be using that one to support myself for the meantime, and when the money is there, then I can actually come up for treatment.
Okay, so you should know that affective disorder, by the time we say it's a disorder, it is a sickness. One is a sickness, is a sick state, like is a disease state. The mind is sick at that point in time. So to say you want to delay, and even usually people that have it, they won't even realize that they have a problem. Okay, so for instance, I just have a patient that, was suicidal. He was writing, posts that he wants to die. He really feels he has been planning, searching for that he wants to kill himself. He didn't see that feeling sad all the time is a problem. So most times when people have affective illness, especially mania, they themselves, they don't even know that they have a problem that needs attention. Treatment. So once it is identified by relatives and families, it is important to go for treatment on time, because prompt treatment influence prognosis or outcome. So those that are treated early, they have better outcome than those that are postponed, because it is a sick state. So it could get worse. It could continue to be distressing. It could continue to make the individual unable to function as they used to regularly and normally. So there are no coping skills than to come for treatment. Once it is identified, it's a sick state. It's just like somebody has fever or have diabetes or have hypertension, and you say you want to cope with it. It's a sickness, and it has to be treated.
Okay, all right. Okay, so now I'm going to be deviating a little bit from the topic of discussion, because I know there is something called seasonal affective disorder. And I know it is also a type of depression. And though this type of depression is always, should I say it's seasonal? Yes, it is seasonal, because it's actually comes up during the season, maybe the raining season. I don't want to use the term winter or summer right now. I want to come to our own term here in Nigeria. Let's say the raining season, the dry season, and the likes. So is there any correlation, like is there any similarity or any difference between seasonal affective disorder and affective disorder?
Okay. Affective disorder generally, like I've explained the other time, is about manifestation of low mood or high mood. So the seasonal one is a pattern of manifestation that is found in a particular season. Like people are observed to manifest a particular type of abnormal mood state at a particular season every year. Okay. So those kind of patients, they will have manifested it for at least 2 years. For instance, during winter or summer, some people have depression, and after winter, depression goes. And then they are fine again, and after the next year, they have the same symptom again. The symptoms are similar to that of depression that is not seasonal.
Okay.
They manifest. In fact, they could even have suicidal ideation, suicidality, they could have mania, they could have, of course, most times it is depression, but bipolar or mania could manifest in a seasonal pattern. So it is common in climate where they have winter, time when they are extremely cold and they don't have a lot of sunlight exposed to them. Okay. So, but of course, here we are in tropics where we have a lot of sunlight every day. And
but during the rainy season, we don't have the sunlight. Like for some weeks now, the rain has been falling back to back. But thank God for the weather.
But you have to know, in winter, that's when they have snow falling
every day.
Do we have that here?
No.
And then they don't have the sunlight that much at that time. And that is why light therapy is used for seasonal affective disorder. They are deprived of light at that time. Okay. And then exposure to light helps. So it's not common here. It could happen, but it's not common in our environment.
Okay, all right. Thank you very much. So now, moving on to the next question I'm going to be asking. Are there any approach, treatment, resistance cases of affective disorder?
Okay, so affective disorder are treatable. Depression is treatable with antidepressant, and medication is called antidepressant. What their work is to reverse the depression, to make the person that is feeling sad start feeling normal again, gradually. Then for mania is also treatable. We use mood stabilizer and antipsychotics. We combine it for them, and then they start feeling normal again. And then some people may not respond to conventional treatment on time. So that's what we call treatment-resistant cases. There are guidelines on how to approach those ones as well. There are treatments like electroconvulsive therapy, like physical treatment. There's things like transcranial magnetic stimulation. Those are new inventions in treatment of affective disorders. So generally speaking, both the treatment-resistant one and the ones that are not treatment-resistant, they are all treatables, and there are guidelines to follow to treat them in the hospital.
Oh, okay. I'm going to be taking these health news before I move on to the next question, because I have a question that is actually bothering my mind. But I'm going to be taking these news first. Okay, so from news from the health sector, the first news I'm having here says, treats patients with dignity and respect. Council registrar tells nurses. The Registrar and Chief Executive Officer, Nursing and Midwifery Council of Nigeria, Dr. Farouk Abubakar, has cancelled nurses to treat every patient they encounter with dignity and respect, regardless of their background or circumstances. Speaking at the induction and oath-taking ceremony of 37 nurses at the University of Ibadan, he said nursing is a profession that requires a blend of knowledge, skill, and compassion, and frontline caregivers who will be instrumental in averting pains, offering comfort, and fostering hope in times of distress. Represented by Timbaku Yami, he said the core of nursing profession is integrity, respect, empathy, and excellence, while upholding the highest ethical standard in all their interactions and decisions. Okay, so when you were talking about some of the ways that affective disorder can actually be approached and treated, you talked about some psychotherapy and the like. So now I want to ask, is there a difference or a similarity between going for psychotherapy and going for the normal therapy? Because some people believe that once they go into depression, let me just go and see a therapist.
Okay. For instance, there's some manifestation of affective disorder that what you do is psychotherapy. For instance, mild depression now, because depression can be mild, moderate, or severe, based on how serious the symptoms are. So for mild depression now, we say they should go for psychotherapy. Okay. Those that have moderate depression, they will need medications. Those that have severe ones also will need medications. So psychotherapy is a form of therapy where they don't give medications, but they talk to them, they find out their psychosocial stressors, problems that could be stressing them, that could be contributing to the illness at that point in time, and find a way to solve them. So psychotherapy is a form of treatment, while by use of other treatment involves use of drugs or use of physical machines to treat. Okay. So there are all forms of treatment. They are recognized form of treatment. It's not like they are similar, but of course they are doing the similar thing in treating the affective illness itself. Okay. But they are different method of treatment. Okay. Yes, exactly.
Okay, all right. Okay, so now we'll be going on a short break, and when we are back, Health Plus continues right here at Omoluwabi Radio 87.7 FM. Don't go anywhere, because this show continues after this short timeout.
Your health is your wealth, no one can deny. It keeps you alive. Hey, hey. Your health is your wealth. It keeps you alive.
Omoluwabi 87.7 FM.
The voice of integrity, 87.7 FM.
Wait. Mama Comfort, where you dey go? You just dey rush.
Mama John, I won't go open my shop. I need plenty sales today. I won't go market soon.
Mama Comfort, shey you don hear about Omoluwabi Radio 87.7 FM? Then they do advert for businesses where we say your market go sell wara. You sef go dey happy.
You mean am? How I go reach them now?
You fit call them on 090-5339-5550. Then go explain to you wella, and their charge no dey break back.
Mama Comfort, it go better for una. Omoluwabi Radio, I dey come o.
Omoluwabi 87.7 FM.
This is calling on all telecom subscribers who are yet to link their national identity number with their SIM to visit the nearest office of their service provider with a valid NIN for verification and linkage, or risk losing the lines permanently. Your service provider will confirm your national identification number in the database of the National Identity Management Commission, NIMC, and help recover the bad number after successfully linking your NIN with your SIM. A link will then be sent to you to automatically link your NIN with your phone number. This message is brought to you by the Nigerian Communications Commission, NCC.
Omoluwabi 87.7 FM.
Attention, attention, attention. This is an important public health announcement. A cholera pandemic outbreak has been declared. Cholera is a highly contagious and deadly disease that spreads through contaminated food, water, and human contact. To stay safe, please drink only treated water. Wash your hands frequently with soap and clean water. Avoid raw or undercooked food. Avoid close contact with people showing symptoms. And lastly, get vaccinated immediately. This public service announcement is brought to you by Omoluwabi Radio 87.7 FM. Remember, awareness and prompt action is the key to preventing the spread of cholera.
Hello?
Hello there. I'm at the hospital right now because the kills are seriously ill. I've been on a long queue and the doctor is here to attend to me. I don't know what to do again.
You know what? How about the numbers I gave you while leaving?
Oh, the e-Dokita numbers?
Yes.
Call them right away. They will attend to you immediately.
Hello?
Darling, just like magic. Junior is playing. Even Princess is eating like an adult.
You know I've told you to calm down. Our family is covered with e-Dokita Premium Plan. With eDokita, you have access to healthcare at your fingertips. Stop wasting your productive hours while waiting in the clinic for doctor. Subscribe today to any of eDokita plans and enjoy online chat and call consult, laser therapy, medical outreach, and home care services. Simply dial 0704-714-2000 or 0701-000-8670. Log on to www.edokita.com or visit us at eDokita, number 2 Ocean Street, New Bodija, Ibadan. eDokita, inspiring wellness.
Your health is your wealth. Hey, hey. It keeps you alive. Your health is your wealth. No one can deny. It keeps you alive. Your health is your wealth. Hey, hey. It keeps you alive. Our health is our wealth. It keeps us alive.
Okay, yeah, welcome back from that commercial break. It is still Health Plus right here at Omoluwabi Radio 87.7 FM. And it is still your wonderful host, Ebonluwa Adibo, doing justice to Health Plus right here with my wonderful guest, Dr. Tunde Theophilus. Okay, before we continue on the discussion of the day, I'm going to be taking this health news that says why poor treatment of malaria may cause kidney damage. Experts. Medical experts have warned that poorly treated and incomplete malaria treatment could lead to malaria resistance, resulting in kidney and liver damage and potential deaths. The experts, a public health physician and a committee pharmacist, highlighted that non-compliance, inappropriate use, and reduced quality of anti-malaria medication gradually rendered them ineffective for further treatment. They cautioned Nigerians against abusing anti-malaria drugs, stating that those who develop resistance to the medication are at risk of untable malaria, organ damage, and death. Okay, so still on the topic of affective disorder with my guest, Dr. Tunde Theophilus. Okay, so the next question I'm going to be talking about, earlier we've talked about the meaning of affective disorder, and we said it is a general term, it is an umbrella term for, let's say, depression, where someone is having different kind of symptoms where you can be happy to this very minute, and the next minute you discover that you are down, you are not feeling happy, and someone asks you and like tells you that what is going on, and you just like, I'm not just feeling anything that's just happening around me. Or better still, you might have the symptoms of losing interest in things that you do before. You just like, I don't just feel like doing, but you're always doing this. I don't want to. I'm not in the mood for it presently. So these are the symptoms. When you are seeing the symptoms, just know that okay, it is time for me to walk into the medical hospital, into the medical practitioner, and tell them that okay, yes, this is what I am experiencing at the moment. And Dr. Tunde also said that we have different types of affective disorder. We have the mania and we have depression, and their symptoms actually varies from each other. They have different symptoms. And they also said that there is no time. He also said that affective disorder is an ailment that you have to walk into the hospital immediately and complain that yes, this is what is wrong with me, because the more you postpone it, the more the symptoms get worse. And by the time the symptoms is getting worse, it becomes an ailment that you might actually just be nursing for the rest of one's life. And it is also genetic. Yeah, you can maybe, if a particular generation suffers depression, and if it is not properly taken care of, another generation can suffer it, and the cycle goes on and on and on like that. And that is why Health Plus is right here at Omoluwabi Radio 87.7 FM, so as to sensitize you, like, okay, there are some things that we don't actually take so serious about our health, but these are the things that we're supposed to take very serious, because our health actually means a lot. It is what we are living for. Okay, so now on to the next question that I'm going to be asking. Are there some lifestyle factors or diet or exercise or anything that would do that actually plays a role in managing affective disorder?
Okay, so when somebody has affective disorder, is pointing to an abnormality in the brain, because the seat of our mind is the brain. So the physical organ in our body that is problematic at that point is the brain. So of course, diet is important for the brain. We need to eat things that are rich in vitamins and minerals, to help the chemicals in the brain to work optimally. Because in depression or mania, there is abnormality with the neurotransmitters in the brain. So which is going to be diet is important to optimize these chemicals so that they can work optimally and then treat the affective illness. Most times in affective disorder, there are theories about different chemicals in the brain that are probably suboptimal or working in an abnormal way that is responsible for the changes in the behavior that is seen. So lifestyle and diet, exercise, diet, they all play important role in the management of affective illnesses.
Okay. So how do affective disorder impacts one's physical life? Because we know that once ailment sets in, definitely the whole life of the person is being altered by that ailment, because it's going to affect the work, the social life, affect family, affect this, affect that. So how do we manage the affected aspects of the affective disorder? Like, how do we just cope? Like, what are the coping mechanisms on how to balance the areas that affective disorder has affected?
Okay, so to make it a disorder, it must have affected the person significantly. Okay, let's take depression for instance now. Imagine somebody that is known to be a cheerful person, and then suddenly develop depression, is sad all the time. He has lost interest in things they like to do. Some people may like reading. For instance, a student that likes reading before, that likes going to the library, suddenly lost interest in reading. They will not be able to function at that point in time. For instance, somebody that is supposed to go to work and then lost interest in working, they will not be able to function at that point in time. Then to the extent that some people feel guilty or they blame themselves for everything they've done in the past. And then they're not thinking of if they die, that's the solution to it. Some people spend hours and time to browse how to kill themselves. So it is an illness that it will have affected the person's life negatively. And that is why treatment is important as soon as it is identified that these changes exist in this individual. So, and illness affect people's life. Take mania, for instance, now. So imagine somebody that is excited and manic, dashing people their things they need. You know, for instance, I've seen a patient that when she collects a salary, she will have given it out to, to people that need, people that did not even ask
for money.
For money, she will have dashed it out to many people.
The lady is good.
It will look as if you are nice, but it's an illness. The kind of kindness they will exhibit at that time is going to affect their lives. So there's no way an illness, it will affect their life, and the treatment is important. So it's not about coping mechanism, it's about identifying it on time. And coming for treatment on time.
Okay. All right. So another question I'm going to be asking is, what are the misconceptions? Because there are a lot of different ailments have their different misconceptions. Some people like, once you tell them that you are going through depression, like, don't move near the person is already you understand now. So I want you to address the misconceptions about affective disorder and how you wish people could understand it more better, because people have to understand, like, okay, when you're having this particular disorder, it is for a particular period of time. It is not forever. That is if you are coming for treatment early. Because like I said earlier, some people just want, like, okay, until when I'm having enough money on me to, like, okay, once I just go into the hospital like this, I'll just start all the treatment and they'll just do and that is the end of it, and I'm going to just forget about the particular ailments. And some people will be like, and why you are still trying to save up that money? People will be like, this person just keep it. Once it starts like this, you won't be able to withstand it. So what are the misconceptions, and how can people around actually understand, like, this is what this person is going through and this is how we can help the person?
Okay, so just like every other mental disorders, affective disorder is stigmatized. Stigma meaning that when you hear somebody is having depression, in fact, commonly people use depression to describe all form of mental illness. So it's like people's what I will say is that we should know that mental illness varies. Psychotic disorder is different from affective disorder. Anxiety disorder is different from affective disorder. Substance use disorder is different. Cognitive disorder. So there are different mental illness.
And
so that's
they're all having different treatments.
Different manifestations. So people that have affective disorder, they have problem with their mood. The problem is mood. They are too happy or they are too sad all the time. So, and they should not be stigmatized because they are treatable. So it could happen to anybody. I mean, it happens to people that are rich, that happen to people that are poor, that happen to people that are even health professionals, and with treatment, people go on to live a normal life as if nothing happened to them. We've admitted patients with significant symptoms of affective disorder, and after days or weeks of treatment, they are fine, their mood is fine, and they're able to go home.
And they're back to normal.
They're able to live a normal life. So what the stigma is the major misconception. People see depression or any mental illness as
because they believe that once it has go, it can still come back.
Yes, that's like it will not go. As if like once it has started, it will not go again.
Exactly.
Then as if I want to address that stigma, that it should not be stigmatized. We should be informed about it, that mental illness is of various types, and of course different outcome, but what we do to it today influences what will be the outcome of it tomorrow.
Okay. So looking at the fact that the technology is advancing and we are having different treatments and different things to treat different ailments. There are different approaches of treating different ailments. What is the latest research findings on affective disorder, and how do they actually inform the clinic, like the psychiatric clinic, like, okay, this is the latest updates on how we can treat the disorder?
Okay, so even from the assessment, the evaluation, how it is evaluated, how the diagnosis is arrived, is the work of research. How those criteria are met. They've studied a lot of people manifesting symptoms, and they found out that this is the way a particular affective disorder manifests itself. From the diagnosis, so now we have manuals that we use that are work of research, that when you have, before we say you have depression, your behavior must have met some criteria. And then based on that criteria, we can say categorically anywhere in the world If you see a psychiatrist, even in developed countries or non-developing countries, anywhere in the world, if you complain this behavior, the diagnosis will be the same. From the evaluation has been a product of research. Then to the treatment, there are guidelines to how it should be treated. There are medication they call first line, like if somebody has depression today, what should you start with? How should you start with? How long should the patient take the drug? When should you stop? When should you continue? How should you adjust the medication? There are guidelines to how patients should be treated based on research, like findings of how it has worked for people in the past and how they are effective. And also research is still going on finding more new drugs that can be used for treatment. And new guidelines are coming from different research. And then different physical treatment are also coming up, like the one I mentioned the other time, electroconvulsive therapy, especially for those that are treatment resistant ones, then transcranial magnetic stimulation, and so on and so forth. Psychotherapy is also been found to be effective. There are also work of research too. So what we do in the hospital today in the world of treating affective illness is a product of research of many decades till now.
Okay, so another question I have here is, how do you collaborate with other healthcare professions? Because okay, maybe a particular patient is going through affective disorder or a psychiatric disorder, and the person is also being diagnosed of another ailment. So how do you balance the equation to provide a comprehensive care for that person? Because the person will be going through this particular let me use diabetes, for example. Maybe the person is going through diabetes treatment and also affective disorder treatment. And there are some drugs that when they collide with each other, they actually have a reaction in the body. And by the time you see the result of the reaction, it brings out another ailment entirely. So how do you collaborate? Okay,
so what we do in the hospital is we do call it multidisciplinary approach to treating a patient. If a patient has affective disorder and also a physical ailment in addition to it, we collaborate together. For instance, if a patient is on the ward now and has affective, we're treated for bipolar. If the patient has diabetes, for instance, we can invite the endocrinologist to come and manage with us. If the patient has hypertension, we can also invite the physicians to manage with us. If we have seen a patient that requires a surgery and they have affective illness, we invite the surgeon. So if the patient have wounds that needs to be managed, we invite the surgeons to come and see, and we collaborate together. So collaboration does exist. So it's easier in a hospital setting, teaching hospital setting, where there are multiple specialists in the hospital. So such patients will be treated by psychiatrists, internal physicians, surgeons, depending on what they need. So collaboration does exist to treat patients with multiple comorbidities in psychiatry.
Okay, all right. Thank you very much. Okay, so the last question I'm going to be asking before I wrap up with you is, what is your last word for people that are going through affective disorder, and how can their family actually help? Their family, their society as a whole, and a word of encouragement to this set of people.
Okay, so when you first notice a change in the behavior in an individual, like this is somebody that used to behave in this particular pattern, suddenly change to behave in a different way, in a way that is distressing to them or making them unable to function normally like they used to function, is pointing to a mental illness. You change an abnormal behavior. So what I will say is that mental illness now in this generation now is treatable, and when we identify it early and treat it early, it influences the outcome. Usually the outcome is better when you identify early and you treat it early. So my advice is, it should not be stigmatized, it should rather be treated. When it is identified, people, just like people that have diabetes, hypertension, they come to the hospital and they come for treatment. It is not stigmatized. People see it as a normal illness. Yes. But when it comes to mental illness, it is stigmatized as if it cannot go. That's not true. Mental illness is treatable like diabetes and hypertension, like every other illness that people come to the hospital to treat. So it should not be stigmatized. People should come to the hospital to assess the care they can get from the healthcare workers, from the doctors, from the nurses, from the psychologists, from all the therapists that are available in the hospital. there are various resources that could be gotten to help the patient and their families to cope. When you come to the hospital and the diagnosis is made, you should ask for your diagnosis, go yourself and check on it so that you know more about it and educate yourself about it and know what are the latest things that is done in the area of treatment of what you have been treated for, so that you'll be informed. So stigma should no longer exist in our environment. We should, at this age, with what is available, mental illness should no longer be stigmatized in our environment. So that's why we encourage people that are listening to us.
All right. Okay. Thank you very much, sir. I hope when next I call you, you are definitely going to respond.
By God's grace.
Okay. All right. Before I wrap up the show, I have a guest in the house that is going to be talking about a particular thing. But before I move on to her, we are going to be taking this short break. And when we are back, I'll be bringing her in.
Your health is your wealth, no one can deny. It keeps you alive. Hey, hey. Your health is your wealth. It keeps you alive. Your health is your wealth, no one can debate. It keeps you alive. Our health is our wealth, it keeps us surviving.
Okay, yeah, it is still Health Plus right here at Omoluwabi Radio 87.7 FM. And like I rightly said before we went on that short break, I said I'm having another guest in the house. She's here to advertise a particular goods. So, good afternoon, ma.
Good afternoon. Good afternoon.
Okay, what's your name and where are you from?
I'm Nurse Olajuyin from Idokita.
Okay, so what do you have for us today?
Well, we are here to introduce Idokita to the people in the society. Idokita is an health organization that deals with taking care of everybody in the society, majorly the preventive health care. And it is not an hospital, it is not a clinic. Majorly, we focus on online consultation and services. You can reach out to our doctors online. You can call us online after subscription. You tell us what is happening in your body and we'll prescribe medications to you. And if you need to go for tests, we'll tell you things you need to go for. Then we also deal with outreaches and partnership with organizations to take care of their staffs. Then we also deal with home care services. You can call Idokita to take care of your loved ones, not necessarily if they are sick, but just for regular checkup. Yes, for checkup. So we'll go to them after paying the subscription for home care services. Then we'll go to your various loved one destination to deliver healthcare services for them.
Okay, so now you're talking about registration, subscription, and every other thing. So how much are we using to subscribe to Idokita's platform? Yeah.
Yes. For the online consult, that's the online call and chat services where you call us, the minimum is 2,500 naira for an individual. Okay. We also have a family plan whereby it can be a family of 3 or family of 5 per month, and the minimum for that is 6,000 naira.
Okay.
Yes.
Okay.
Then for the home service, you have to call us and tell us the location so we can tell you the service charge for such areas and the services.
Okay. So what about the ones for organizations? Because you made mention of that too.
Then for the organization have to reach out to Idokita. You tell of your